Bismillahirrahmanirrahim. Quote of the day is adopt the pace of nature. Her secret is patience. Today, the topic of my presentation is quality of healthcare and frameworks for assurance of quality, and I am presenting it under the supervision of Professor Dr. Saira Afsar. Learning outlines. Learning outlines of the presentation are dimensions of healthcare quality, quality management and planning, quality assurance, quality improvement, frameworks for quality assurance, frameworks for quality improvement, and recent updates. Learning outcomes are at the end of this presentation, participants will be able to describe dimensions of healthcare quality, components of quality management, and models of quality assurance and quality improvement. Healthcare quality. It is defined as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcome and are consistent with current professional knowledge. Dimensions of healthcare quality. This picture shows dimensions that these all are safe, equitable, timely, effective, efficient, and patient-centered. Amongst these, safe means avoiding harm to patient from care intended to help them. Equitable is provide care that does not vary in quality because of gender, ethnicity, geography, or socioeconomic status. Timely means that reducing wait and sometimes harmful delays so that those who receive can give care. Effective means that all those who are receiving services should be scientifically effective. Efficient is that it avoid waste of equipment, supplies, ideas, and energy. And it should be patient centered. Health quality care can be defined in many ways, but there is growing knowledge, and healthcare services should be effective, safe, patient centered, and to realize benefits of quality health care services must be timely, equitable, efficient, and integrated. Now, what is integrated? Integrated is providing care that makes available the full range of health services throughout the life course. Equitable is providing care that does not vary in quality on account of gender, ethnicity, geographic location, and socioeconomic status. Patient-centered is providing care that responds to individual preferences such as needs and values. Quality management. Quality management is the act of overseeing all activities and tasks that must be accomplished to maintain a desired level of excellence. This includes the determination of a quality policy, creating and implementing quality, planning and assurance, and quality control and quality improvement. And now, what is total quality management? But a core definition of the total quality management describes a management approach to long-term success through the customer satisfaction. In a total quality management effort, all members of an organization participates in improving processes, products, service, and the culture in which they work. The principles of total quality management. First is customer focus. Total quality management's first and foremost pillars of success is an unwavering focus on the customer's experience in all interactions with the organization. From the first contact through purchase and continued support, the customer should always be the main priority. Second is employee ownership. Total quality management requires the involvement of every team member to ensure that the complete quality control is offered at every level. Total quality management does not focus on a single department because the goal is to provide customers with a great experience from every level of organization. Third is process-based. Total quality management focuses on the creation and implementation of the processes that provides organizations with the ability to find success and repeat it. Uh, Quantifying success and defining the steps taken to get there are essentials for successful implementation of total quality management. System integration. Total quality management strategies revolve around leveraging every asset available to the company. This is best achieved through system integration that combines disparate parts of the organization into a well-oiled machine working in a complete synergy. Fifth is communication. Total quality management requires every team member to be at their best and to function as a value adding member of the team. This means communication and transparency is a core tenet of the successful total quality management practice. Data driven. Total quality management does not employ guesswork. Instead, data is leveraged for the improvements of the organization, and decisions are made based on quantifiable facts. Constant improvement. Total quality management isn't a one and done process. Perfection is impossible, so it must always be pursued to get the organization as close as possible to it. Now, components of quality management. There are four basic components: quality planning, quality control, quality assurance, and quality improvement. All these points are discussed in detail in next slides. Now, what is quality planning? Uh, the role of quality planning is to design a process that will be able to meet established goals under operating conditions. Quality planning is a methodology which can be used when a situation exhibits one or more of the following characteristics. First is a service is never existed before. Second, customer requirements are not known. Third is the existing services or the process performance is not capable of meeting customer requirements. The service process is ad hoc, extremely variable, never been well defined or worked on before as a whole. The environment is unstable, characterized by major market, technology, or organizational change. Performance data does not exist, or it would require excessive time, expense to collect data. Quality planning cycle. Four basic things are involved in quality planning cycle. First is design and plot service process. Second is the monitor impact results of services. And there is take action and define opportunity and stakeholder needs. All these points are interconnected and lead to each other in a successful way. Quality control. Quality control can be defined as a part of quality management focused on fulfilling quality requirements. An alternate definition is the operational techniques and activities that are used to fulfill requirements for quality. It is the system of maintaining standards in manufactured products or services by testing a sample of the output against the specification. Quality of good or service produced are measured using tools such as auditing and inspection. In project management, quality control requires the project manager or the project team to inspect the accomplished work to ensure its alignment with the project scope. In practice, projects typically have a dedicated quality control team which focuses on this area. Quality assurance. Quality assurance can be defined as part of the quality management focused on providing confidence that quality requirement will be fulfilled. The confidence provided by the quality assurance is twofold. Uh, Internally to management and externally to customers, government agencies, regulators, certifiers, and third parties. Quality improvement. The combined and unceasing effort of everyone to make the changes that will lead to better patient outcome, health, better system performance, that is care, and better professional development, that is learning. This may be done with the noticeable significant changes or incrementally via continual improvement. In healthcare, quality improvement is the framework we use to systematically improve the way care is delivered to patients. Purpose of quality assurance: to meet the rising expectations of the consumers of quality of services, help patients by improving quality of care, assess competence of medical staff, serves as an impetus to keep up to date and prevent future mistakes, bring to notice of hospital administration about the deficiencies, and in correcting the causative factors, help exercise a regulatory function, restricting undesirable procedures, eliminating medical error, adverse drug events. Components of quality assurance: strategic organizational level, uh, tactical or functional level, and operational level. At the organizational level, it deals with the quality policy, objectives, and management, usually produced as quality manual. On functional level, deals with general practices such as training, facilities, and equipments. And at operational level, it deals with standard operating procedures and day-to-day operations. This slide shows a comparison among the quality assurance and quality control. That quality assurance is a managing tool. It is process oriented. It is proactive strategy. It helps in the prevention of defects. Everyone's responsibility, and it is performed in parallel with the project. While quality control is a corrective tool, it is also product oriented, and but it has reactive strategy. It helps in the detection of defects. It is testing team's responsibility and is performed after the final product is ready. This slide shows examples of differences among the quality assurance process and quality control procedure. That it deals with the documentation, audit, supplier management, personal training, investigation procedure, and change control. While quality control is associated with batch inspection, product sampling, validation testing, and laboratory testing. Quality assurance and quality control are closely related concepts and are both aspects of quality management, but are fundamentally different in their focus. Quality control is used to verify the quality of output, and quality assurance is the process of managing for quality. Approaches of quality assurance program. Two approaches are used: general approach and specific approach. General approach involves a large governing or official body's evaluation of a person or agency to meet established criteria or standard at a given time. Licensure, accreditation, certification, and credentialing. A specific approach is peer review, uh, standard as a device for quality assurance, and audit as a tool for quality assurance. Now, first is credentialing, process by which eligibility of an entity for a particular job or task is established by determining if the entity has the specified qualifications and fulfills the defined requirement. For example, it is the licensing of medical providers like physician, nurse, and practitioners. Licensure is the individual licensure is the contract between the profession and the state, in which the profession is granted granted control over entry into and exit from the profession and over quality of professional practice. For example, medical and legal practices. Accreditation. Accreditation is the process of formally obtaining credibility from authorized bodies such as the International Organization for Standardization, Joint Commission International, etc. Certification is usually a voluntary process within the profession. A person's education, experience, and performance or examination are used to determine the person's qualification for functioning in an identified specialty area. Areas of quality assurance. These are all outpatient department, emergency medical services, inpatient services, specialty services, and training. Factors affecting quality assurance in healthcare. Multiple factors are there. First is the lack of resources, personal problems, improper maintenance, unreasonable patients and attendants, lack of incident reports, absence of laws, absence of well-informed population, lack of medical records, and so on. Now, frameworks or models for quality assurance. First is Donabedian's model. Donabedian's model is to analyze quality, includes three factors: structure, process, and outcome. Structure refers to prerequisites such as hospital, building, staff, and equipment. Process describes how structure is put into practice, such as specific therapies. Outcome refers to results of processes, for instance, result of therapy. This is the ANA model of quality assurance. It identifies values, identifies standard criteria, secure measurement, make interpretation, identifies possible course of action, choose appropriate course of action, take action, and reevaluation, and the cycle continues. The Deming cycle is a continuous quality improvement model which consists of logical sequence of four keys that are plan, do, study, and act. What changes can we make that will result in improvement? How will we know that a change is an improvement? Are the fundamental questions that are used in this Deming cycle. Now, plan is the quality principle, do is the policies and procedures, check is to error checking, and act is review, revise, and communicate type procedure. Four steps are a plan is an analysis that establishes the objectives or the expected results and creates a plan of action. By starting with the objective or desired results, each step of the process can be included in the analysis and in the solution. Do is implementation of the plan. Check is measurement of the objectives to see how closely they meet expectations. This is an important step as it allows for the adjustment of the plan as needed, and act is the implementation of the changes. Models of quality improvement. Aim of these models is to determine which specific outcomes you're trying to change, and measure is identify appropriate measure to track your success. What are we trying to accomplish? How will we know that a change is an improvement, and what change will make that will result in an improvement? All these are the questions that are commonly asked in Deming cycle. Focused PDCA is a strategy that provides a roadmap for continuous process improvement when linked to the quality definition. Focused is an improvement methodology to guide the improvement effort. It is simply a 9-step process guide to quality improvement. Another cycle is used, it is the Schubert cycle. That is, find a process to improve, organize, clarify, understand, and select. Recent updates. About 5.7 to 8.4 million deaths per year are due to poor quality care in low and middle income countries, and up to 15% of deaths overall. 1.4 to 1.6 trillion dollars are lost in productivity each year due to inadequate quality of care in low and middle income countries. 1 in 3 people report negative experience of their health system, such as disrespectful care, short consultation, and long waiting time. Key facts are that the Substantial Development Goals stress that the quality is a key element of universal health coverage. Sustainable Development Goal target 3.8 calls on the countries to achieve this, including financial risk protection alongside access to quality essential healthcare services. Between 5.7 and 8.4 million deaths are attributed to poor quality care in each lower and middle income countries, which represent up to 15% of the overall death in these countries. 60% death in the lower and middle income countries from conditions that require health care occur due to poor quality care. And inadequate quality of care imposes cost of about US dollar 1.4 to 1.6 trillion each year and a loss to productivity. In high income countries, 1 in 10 patients is harmed while receiving hospital care, and 7 in every 100 hospitalized patients can expect to acquire a health care associated infection. Globally, the essential structure for achieving quality care are inadequate. 1 in 8 healthcare facilities has no water service, 1 in 5 has no sanitation service, and 1 in 6 has no hand hygiene facility at the point of care. An estimated 1.8 billion people, or 24% of the world's population, live in fragile contexts that are challenged in delivering quality essentials health services. A large population of the preventable maternal, childhood, and neonatal deaths occur in these settings. The Universal Healthcare Coverage and Quality Care, a global commitment. The UN Political Declaration, adopted by the world leader in September 2019, reaffirmed the commitment to progressively cover 1 billion additional people by 2023 with the quality essential healthcare services with the view to cover all the world's people by 2030. Another article published is the use of Donabedian's model as a framework for COVID-19 response at a hospital in suburban hospital in New York. It's a case facility level case report. This article shows that using this model as a guide, both structure and process changes are implemented to maintain high quality clinical outcome as well as the staff safety and engagement. Rapid changes due to model of care both for architecturally and through the expansion of universal precaution through personal protective equipment created the foundation for what was to follow. Coming towards the MCQs. First MCQ is a product ABC is having great profit in market because its production is regulated and checked routinely. A collection of strategies, techniques, and actions taken by an organization to assure themselves that they are producing a quality product is called. Option A is quality control, option B is quality assurance, option C is quality improvement, and option D is quality assessment.
B.
A.
Option A is the right one. Quality control is this process. Quality management is the act of overseeing all activities and tasks that must be accomplished to maintain a desired level of excellence. Healthcare quality defines that an attribute of which care should be based on individual needs. Option A is advanced care, option B is evidence-based care, option C is patient-centered care, and option D is modern care.
B. Evidence-based care.
Option C is the right one, patient-centered care. Third MCQ is quality of healthcare is the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcome. Quality care often means which of the following care for patients. Option A is superior care, option B is advanced care, option C is safer care, and option D is costly care.
C. B.
Yes, C is the right answer. Safer care is the right one. Fourth MCQ is the systematic activities and planned activities which provide adequate confidence that the manufactured products are meeting the requirement is called as. Option A is quality assurance, B quality control, C is inspection, and D is assessment.
A.
Yes, A is the right answer, quality assurance. Fifth MCQ is which of the following is not one of the fundamental questions to be asked in a Deming cycle methodology? Option A is what we are trying to accomplish. Option B is who are the processes owners of the quality initiative. Option C, what changes can we make that will result in improvement? And option D, how will we know that a change is an improvement?
B.
Yes, B is the right answer. Sixth MCQ is in town A, the healthcare was provided to the resident with the quality not varying due to their socioeconomic status. Which of the following dimensions of healthcare quality is highlighted here? Option A is efficiency, option B is effectivity, option C is equity, and option D efficacy.
C. Equity.
Yes, C is the right one. Seventh MCQ is which of the following is associated with the developing the process that are needed to deliver a quality product or services complying with the customer need. Option A is quality planning, B is quality control, option C is quality improvement, or option D is quality assurance.
D. Quality control. D.
C is the right one. Quality improvement is associated with developing the processes that need to deliver quality product. Eighth MCQ is to generate possible solution and to select the most feasible solution. Is the part of which phase of Deming cycle? Option A is plan, option B do, option C check, and option D act.
A.
Yes, A is the right answer. Planning is the ninth MCQ is quality control comprises of the operational techniques and activities for maintaining standards in manufactured products or services by testing a sample of the output against specification. Which of the following is not true about quality control? Option A is corrective tool, option B is process oriented, uh, option C is reactive strategy, and option D is testing team's responsibility.
B. Process oriented. B.
Yes, B is the right answer, process orientation. 10th MCQ is quality assurance consists of all the planned and systematic activities implemented within the quality system to provide confidence that a product or service will fulfill requirement for quality. Which of the following is not an example of quality assurance? Option A is documentation, option B is laboratory testing, option C personal training, and option D investigation procedure.
Lab testing. A.
B is the right answer. Laboratory testing is not included. This is the key, and thank you.
Thank you very much, Dr. Isma. Very nice presentation, especially